Less, I've never seen anybody say that they didn't feel better when they take take the sugar and the carbohydrate out of their diet, just in terms of their cognitive function.
Yeah, it's because of all the inflammation. I must say that I failed to list on my reference sheet, so there's a supplement. Everyone's assignment today is to get this paper and read it by Giuseppina Basta, and it should be a supplement. It's Advanced Glycation End Products and Vascular Inflammation, Implications for Accelerated Atherosclerosis in Diabetes. It's a really great paper about advanced glycation products and how they create inflammation. I think it's fascinating when we talk about cognitive function, which is a particular interest of mine, the effects of lead on the brain and the combination of that and a relative insulin resistance and the increased risk of dementia in diabetes. There's a connection. There's some very interesting studies showing that if you get into ketosis, memory improves. That's the approval of Axona, and it's very effective. I like to put my demented patients on Axona, which is powdered ketones, and it really does improve memory, but I would like to get them into ketosis. There's a lot of very interesting research on that, but if I may mention one connection is that what is the cause of insulin resistance? Of course, overeating carbohydrates, lack of exercise, all the things we talked about. But there's another interesting connection between the dementia and diabetes, and that's lead. And as lead leaks out of your bone, lead interferes with insulin-degrading enzyme. And insulin-degrading enzyme degrades insulin after a meal. So when you have a carbohydrate meal and your glucose goes up, and glucose is supposed to send insulin is supposed to send the glucose into your cells, but as you develop insulin resistance, that doesn't happen, so the glucose has nowhere to go, and that's when you get all these inflammatory products. Lead inhibits the enzyme that gets rid of insulin. So many of us thought for many years that cell receptors downregulate because of elevated glucose and insulin levels. But much of the new research is showing just the opposite, that it's the paralysis of insulin-degrading enzyme that causes hyperinsulinemia, and then the cells downregulate to high insulin levels. So it may be that lead's effect on insulin-degrading enzyme is the cause of insulin resistance. And when you look at the brain, when you look at beta-amyloid plaque is basically just structural proteins that are being excreted from the cell into the intracellular space. And there's an enzyme a protease that's supposed to clean up all those proteins into individual amino acids and recycle them. And that protease is insulin-degrading enzyme, and lead inhibits insulin-degrading enzyme. So there's a lot of great studies, mostly from Purdue, that show how lead inhibits and creates beta-amyloid plaque. So the connection with diabetes and insulin resistance and Alzheimer's disease may be lead.
So shall we say that then there is a type of diabetic patient that may be deteriorating rapidly, and the culprit may be that they have high lead?
Yes.
In comparison to
and
the
I've been studying the improvement in insulin resistance with chelation.
And do you see persistent, like if you have them on a good diet, you have them on the low-carb diet, and their blood sugars are getting better, but the insulin level still, the fasting insulin is still high, those would be the people to look at.
The only thing I would add to that is the recipe is get them off carbs, watch everything. If it's not improving, make sure that I didn't forget to monitor for sleep apnea. If they got sleep apnea, they have that glucose rise every single night because of hypoxemia.
Stress.
So if you don't fix the sleep apnea, you don't get the numbers down. If they still don't come down, then I know there's lead probably as the culprit.
And one thing I just want to add is weight loss is so critical, because both in terms of the metabolic syndrome, in terms of the waist circumference, and in terms of sleep apnea, I mean, if you can get somebody to lose...
cures everything.
It cures everything. And I've used HCG diet very, very successfully in my practice to get people's weight down really quickly so they get the reward of it.
Yes, let me add something that we haven't talked about yet at all as far as mentation and memory and clarity and anxiety and all kinds of those symptoms, and that is yeast. And we've all treated people and they can, gee, my memory is better and I'm not as depressed, I'm not as anxious as I was. That goes back to the diet and the sugar and the whole thing we're talking about, but yeast, yeast, yeast.
Thank you.
So look at it, treat it.
For
Dr.
me,
Campbell?
the nutrients that I would use for cognitive improvement primarily are alpha-lipoic acid, coenzyme Q10, sometimes ginkgo, and whatever it takes to normalize the 4-point salivary cortisol graph.
Thank you. And this is the end of our morning session.